My name is Wuta Blessing Williams, a underlevel student of Health Care Management Stroke Nursing in GPTS School Institute of Management, Science and Technology in collaboration with South American University, USA, Global World University, Togo, Pan American College, California. I'm presenting a brief seminar paper on the theme Attitude of Nurses Towards Relapse Prevention Among Psychiatrists in Neuropsychiatric Federal Hospitals. First of all, we'll take a little insight into some terminologies. Who is a nurse? A nurse is a person who gives care to people who are ill. What is relapse? Relapse is the interval between a convalescence of illness, the return of an illness after an interval of convalescence. What is a psychiatric? Psychiatric has to do with mental illness and its treatment. Then what is neuropsychiatric? This has to do with psychiatric and neurology. Now, taking a deep look into what relapse has been through the years, it's a very common illness in people with mental disease, and it is a severe problem faced by health caregivers. The attitude of nurses towards relapse prevention among psychiatric in neuropsychiatric hospitals in the past were revealed to be intolerant due to the way the mental illness is in patients. The nurses as at then find it difficult to tolerate the agitations, the aggressive attitude of the patients, anger, distrust, frustration, saying that a patient might have come in and was showing symptoms of wellness, but within an interval it returns again. It got the nurses frustrated, thereby giving rise to poor treatment and poor caregiving to the patients. They also felt that patients in relapse and psychiatric hospitals were hopeless and irresponsible because there was no good education and awareness created in nurses then. This led to a rise in depression among the patients. But studies have shown that over the years, the attitude of nurses has changed towards psychiatric patients. Nurses are now more educated and aware of what they may encounter with their patients and in the facility, and are taught to be prepared to help the patients by being friendly, creating a friendly environment for the patients. If a patient comes in showing signs of anger, frustration, the nurse will have to make the environment friendly as possible for the patients, because there are numerous kinds of psychiatric patients, the one that comes in voluntarily and those that comes in involuntarily. Those that come in voluntarily, they seem to get tired along the time because of there is no freedom of doing all what they intend to do. But if the environment is not friendly, they will tend to be tired and want to leave the environment, the facility. But as the nurses create a very good, friendly environment for the patients, they stay, they try to stay, and their treatment will be perfected. Then also understanding. Nurses has been taught to understand the situation surrounding the patients, the pain, the emotional breakdown, the mental breakdown, and otherwise. They tend to give this attributes, show these attributes to patients in the facility. Also, they've been told to assess the mental state of the patients. The mental state of the patient has to do with how the person thinks or reason. You don't expect a relapse or a mentally sick person to behave normal. So they are taught to always understand how the patient will behave. And this has created a better environment, a better place for a relapse and psychiatric patients. Nurses have really improved over the years, and with their help in the hospitals, the psychiatric facility are now more approachable for patients. Thank you.